Now, before we get started, I'll introduce our speaker. Dr. Adrien Eshraghi is board certified in Otolaryngology, head and neck surgery, and neurotology. His training and experience encompasses medical, surgical, holistic, and integrative approaches to disease management. By combining these approaches, he provides comprehensive management of ear and hearing disorders. He is also a recipient of an Autism Research Institute scientific research grant. These webinars are made possible thanks to generous donor support. If you'd like to contribute, please visit our website at autism.org. And now I will turn this over to our speaker.
Thank you, Denise. Thank you very much for your introduction. Welcome, everyone. Thank you for joining. Today, we are going to talk about otolaryngologic comorbidities seen in autism spectrum disorders. So otolaryngology is a difficult word maybe for you, is casually said ENT, ear, nose, and throat doctor are called also otolaryngologist. And the neurotologists are the one who are specialized in the ear and the connection of the ear with the brain. So I'm a neurotologist. That's why I have a lot of interest about what's happening with our children and adults on the spectrum. So I work at University of Miami. I'm also director of the University of Miami Neurodevelopmental Communication Disorder Laboratory. And we have actually a grant from ARI, and we are very grateful to that. So our agenda today is to have an overview of autism spectrum disorders with a sensory profile, because sensory disorders is not very well known by everybody, and for many years was not considered to be one of the core symptoms of autism, but definitely is very, very important to talk about it. And the ear, nose, and throat specialists are people who manage at least 4 of 5 senses of our bodies. We're going to talk about hearing loss. We're going to talk about hyperacusis, tinnitus, which is noise in the ear. We're going to talk about auditory processing disorders. We're going to talk about balance problem, ear infections with otitis media, sinus disorders, sleep disorders, and we're going to have some time for questions. This is a paper that we published recently that talk about incidence of ENT manifestation in individual with autism spectrum disorders. And you are welcome to find this paper that is actually free online and gets a lot of the information that we are talking on a scientific manner. So autism spectrum disorder at the glance, as you know, the prevalence is 1 out of 31 now in the US. Significant increase when you look at year 2000, that was 1 out of 150, but now it's 1 of 1,000. From 1 out of 150, now we are at 1 in 31 children. Very significant. Male to female ratio is 4:1, as you know. Core symptoms have language delay, repetitive behavior, and deficit in social interaction. And I want to emphasize that I like to add a 4th one, which is the sensory feature, that is hyperacusis, sensory deficitness, poor habituation, and so on. So there's a lot of ENT overlap with the symptoms that individual on the spectrum can complain of. So why ENT matters in ASD? We talk about hearing disorders, we talk about auditory processing disorders, otitis media, sinusitis up to 40% compared to the normal patients, and sleep problems also. So this impact can really change the irritability, communication, and daily functioning of individuals with autism. I think it's very important to know these things, especially about with the young children, because they cannot always express themselves, and sometimes managing those comorbidities can really improve the quality of life of individuals who cannot express themselves. So The objective of this talk is to decrease the burden of ENT comorbidities, review some diagnostic pathway, hearing test, vestibular testing, sinus, CAT scan, summarize some management therapy, including hearing aid, cochlear implant, and promoting collaboration between otolaryngologists, pediatrician, neurologist, and psychiatrist. So let's talk with the hearing. There is two types usually of hearing problem. The one type is the conductive hearing loss, and the other type is the sensorineural hearing loss. Conductive hearing loss is with the conduction of the sound wave, as you can see here, to the ear canal, eardrum, and middle ear is not happening appropriately, while the sensorineural hearing loss is when the problem happened in the cochlea or in the auditory nerve. So most common congenital sensory impairment in children is usually hearing loss, and with kids with autism spectrum disorders, that's an increase of these numbers. So early diagnosis of hearing loss is important. Why? Because untreated infant can have speech, language, cognitive, and social delays. So we have to do always a newborn screening that happens when the baby is born in the hospital. And if there is an issue with the screening, usually they do a confirmation by 3 months. And if there's still confirmation that there is a hearing problem with the baby, then you should have at least the hearing aid started within 6 months. So that detection going to help to improve speech and language outcome. So from 1 month to 6 months, if the hearing is improved, great, using the hearing aid. But if it's not improved, then we have to do more testing, such as ABR. Usually with the children with autism, we like to do that in the operating room to have the kids sleep and do some testing, electrophysiology testing that's very objective, that does not require the participation of the children. And if that confirms that there is a profound hearing loss, then we can maybe discuss the need for a cochlear implantation. But we don't do that unless there is a need. Usually, the hearing loss can be mild, moderate, and then we can use hearing aid. And starting early on, the treatment of the hearing loss is extremely important for helping to improve the speech and language. Remember, speech is not only what we say, it's also if we hear and we understand the language. So the capacity of having an expressive speech does not always correlate with the speech perception. So these are two things that you have to always keep in mind. So hearing loss. Hearing loss 10 times is more prevalent in autism spectrum disorder population compared to the neurotypical individuals. Out of 199 children on the spectrum, 7.9% of them have mild to moderate hearing loss, and up to 3.5% have bilateral hearing loss. Some studies even talk about having a co-occurrence of hearing loss up to 35%. Again, 35% doesn't mean that they are profound hearing loss, but that can have some degree of hearing loss, as you can see in the audiogram pictures I have on the screen. Unfortunately, 22% have hearing loss that is not recognized for many years. So that's why it's important that any individual on the spectrum diagnosed have a hearing test to be sure that the hearing is appropriate. Well, just to explain you how we read that, you can see here we have different frequency, 25 hertz to 8,000 hertz. And here is the degree of hearing loss that goes from 10 decibel to 20 decibel, 30 decibel, 40 decibel. And when it goes above 70 decibel, it's severe to profound. That really challenge for hearing. Here in this patient, you can see that in the low frequency, he have 20 to 30 decibel loss, but in the high frequency, the hearing loss is much significant, 70 to 80 decibel. High frequencies usually correspond to the voice of the mom, the voice of the children. That's very high frequency. And lower frequency is usually the voice of father. So 1 out of 3 children with hearing loss actually have autism is on the spectrum. It's very interesting to see how this can correlate. Remember that if you have both hearing loss and having autism, you're going to have poor educational outcome, and the school impact can be very significant. So what's the takeaway? Always test hearing in suspected children or adults on the spectrum and screen for autism in pediatric patients with hearing loss. So now let's talk about hyperacusis. What's the hyperacusis? Hyperacusis is when the loud sound or even normal sound appear to be very loud and painful. So you have seen individuals with autism holding their ear when there is a loud sound outside. That's because the tolerance to the loud sound is much less, causing this problem. They have a restricted dynamic range. That means that normal thresholds for hearing and pain are different, and anybody has a pain if the sound is too loud. You go to a party, the sound is at 110 dB. If you use your iPhone or your cell phone to check the sound level, you can start to see that it's bothering your ear, it's painful. But unfortunately for individuals with autism, the threshold is not at 110 dB, it's much lower. That's why they hold their ear, and it's difficult. So they have distress, they try to avoid noisy environment. So misophonia is something a little bit different. Misophonia is when there is a pain, discomfort with the sound, but not with every sound. Some specific sound, like chewing, like sniffing, sometimes parent talking, mechanism is something happening in the limbic system, and I don't want to go to detail of that part, but there is a lot of emotional connection related to this misophonia that require involvement of psychologists to help you to manage that. Now let's talk about cochlear implantation for individuals with autism. I published a paper very few years ago. That was one of the first papers that shows that patients who have deafness and autism can benefit from cochlear implantation. Early studies were a little bit questioning that, because initially the kids with autism who are implanted with the cochlear implant presented more discomfort, more behavior problem. So some people say that we should not implant them. We demonstrated that early behavior change is just temporary. Probably is because the kid become aware of the sound, understand better what's going on, and overreact to that. But in the long run, after a short time, the kids become adjusted and actually can develop speech, perception, speech expression, and their quality of life and their quality of life of their family change significantly. Up to 86% of the parents with the kids who have deafness and autism report that the social engagement of the kids are a bit better, and the kids use the device consistently, and they develop, at least for half of them, speech perception and speech expression, which is very important for their quality of life. So this is a study I was talking to you about. You can Google my name, Google about cochlear implant. You can find the detail of the paper. We have a special speech perception category and a speech expression category that we proposed in our paper that goes from 0 to 4. Because what is important is not all of those big tests that we hear in some of the conferences. But what is important for a parent with autism is that the kid can identify words, can understand simple phrases, and participate with the family conversation, or can express few words, or can express his or her needs. So this is very important, and we have seen that over 50%, up to 60% develop those level of speech, if it's not for some of them conversation level, if they are implanted early on. Now let's talk about central auditory processing disorders. Auditory processing disorders is a category of challenge for hearing. Some patients come to see, we say, my hearing is good, but I cannot make sense of the conversation. I have difficulty to hear when there is a background noise. I have difficulty to localize the sound. So those patients, maybe their inner ear in blue here is functioning well, but the connection from the ear to the brain and the processing of the sound in the brain have causing the problem, which is typical with the autistic individuals who have challenges with the long and short fiber in the brain that connect different area of the brain, and that cause difficulty to talk, but also maybe difficulty to also understand the speech. So many of the kids express challenges to hear in the noisy environment, the classroom, and these are significant issues that need to be addressed in IEP and help the parents. When we do some tests, again, we try to do the test in autistic kids with an ABR, which is an auditory brainstem response that help to have an objective result about that. We can see that there might be some mismatch negativity. I don't want to go too much in the medical term, but those tests can objectively show that even though the kid is hearing, because the conduction of the nerve and the sound is not done appropriately, there is difficulty to understand the sound and the speech. How do we manage the individual on the spectrum with the CAPD, or even adults that have auditory processing disorders? Usually is challenging because there's no magic pill to take. But we have to modify the environmental setting by, like for the kids, having them sitting in the front of the classroom, trying to give them some written instructions. Certainly for adults who are working in an environment that is noisy, they should close the door when they are in a meeting, decreasing the background noise. There is also some training program that you can find in the internet. One of them is very known, is Fast Forwards. Unfortunately, they are somewhat more expensive, but they can train your ear to overcome this challenge. FM system is also a good system that can be used in the classroom when the teacher has a microphone at the neck and the student on the spectrum or the individual with the auditory processing disorders have a small hearing in the ear that can get the information direct to the ear, decreasing the background noise. So now let's talk about balance problems. The balance problem is also very well known for individuals on the spectrum. Sometimes they have problem with the motor activity, instability. We know that there is 3 areas in the brain that are really, at least we have in the imaging, have some deviation from the I want to say typical MRI of the brain of the neurotypical individual. One is the cerebellar area with the possible hyperplasia. And the test that we use in an ENT office is obviously after hearing test to see the hearing level. We use VNG, we use caloric test, we can use VAMP. And sometimes we can use posterography. Those tests, some of them are easier to do, some of them more challenging. Like we have to put water in the ear, cold or warm, and see the movement of the eyes. So sometimes the individual with autism do not like to have those tests, but some of them are easier to do, like VAMP or posterography, where you stand on the on a specific device and closing your eyes, opening your eyes. They're gonna see how much is impact of the visual sensory on your stability and your balance. As you know, the balance is managed by three: neurological, ophthalmological, and ear function. So your eye, brain, and ear help you to have a stability of posture. And if one of them is disturbed, then you can have problem with the balance. So it's good to identify which one and have the appropriate balance therapy. Vestibular intervention includes sensory integration therapy, trampoline, martial art, swimming. These are things that you know that the kids love. Uh, there's not enough studies performed on individual autism with those tests. I want to say to have really some standard result because it's uncomfortable, and we want to avoid that if we can on our patient on the spectrum because they have sensory sensitivity challenges, and we don't want to challenge that. Now let's talk about another area is the otitis media, ear infection. We know that the kids with autism have higher infection risk, and that's why their pediatrician give them more antibiotic. And that's a little bit area that I am a little bit sensitive to that. I think we have to be careful. Too much antibiotic can change the microbiome of the kids with autism, and that gut-brain connection. Actually, I wrote a book about that. I did a book about that. It's very important with the behavior of the children. We want to avoid doing that as much possible, but if we do that, we want to supplement with probiotic, prebiotic to reestablish as soon as possible the gut microbiome. So you can see here, we place tubes in the ear of people who have recurrent, repeated ear infection. If you have more than 6 infections per year in a neurotypical kid, we want to put the tube to avoid the kids to have more infection of the ear. But personally, in my practice, if I have a children with autism, I have a faster reaction to offer the tubes for them. In case if they have 2-3 per year, I try to put the tube to avoid too much antibiotic for them. So behavior impact is obvious. When you have pain, infection, frustration, kids cannot express themselves and they can be more aggressive, but that's because they are in pain because they have infection. And the tubes, as I mentioned to you, can help the kids to have less infection and therefore less behavior problem. And less infection you have, less you cause problem for inflammation in your body. Many of the kids with autism, when you have infection, they regress also because the inflammation cause regression with them. So we want to avoid as much possible to have regression in individual on the spectrum. So I talk about that. I have a book, we can look at that if you want. We know that some bugs are more frequent in the kids with autism, like Clostridia. That's why many of the kids with the Clostridia respond very well to Flagyl as an antibiotic that help them. And it's very important to manage well the GI system of the children with autism because that impacts not only their diarrhea or constipation if they have that, but also that's going to improve the gut-brain connection and their neurological function. So this is something that always I emphasize, that start with the gut, manage the gut well, because that's going to impact the overall behavior, the overall sensory disorders that we observe in the children with autism. Now, a small consideration that we not talk about anesthesia. If the kids goes to the surgery, like putting a tube or other surgery, it's always good to remember that many of the children with autism have some problem with oxidative stress, and mitochondrial dysfunction and with the methionine pathway. And I always recommend to avoid nitric oxide as a anesthesia drug because that can make worse the oxidative stress via B12 and folate depletion. So we try to avoid that. And the strategy is to use some oral or injection of pre-medication to reduce stress because we don't want to expose the kid with autism to stress. I personally, when I have a long surgical day, when I have children with autism as a patient for schedule for surgery, I always manage that they are the first person in the operating room schedule, so they don't have to wait. If they wait, it's stressful, it's not comfortable for them. So these are things that you need to talk with your surgeon, with your physician, so they remember that they should put their kid with autism first. I even in my clinic, when I have patients, if I have a children with autism, I try to have them sooner possible in the clinic. We actually published a paper also during the COVID about the challenges of children with autism during the COVID, and we discussed that lengthily. This paper was published in Lancet Psychiatry and had a very good audience, and we come up with a significant number of recommendation that if the children with autism goes to ER, we need to inform the ER receptionist, the physician, so they don't make them wait for hours in the ER. And I think this is not only for COVID period, but should be also with normal situation. The ER have to be ready to manage the children and adult with autism who have hyperacusis challenges in a noisy environment to be seen as soon as possible to decrease the trauma and challenges for them. So sinus infection, that's another area that I think we have to be aware that the 40% of the children with autism can have sinus infection and they need to be treated appropriately. That can make worse the sleep, can make worse the irritability behavior, and that treatment, once appropriate, going to improve the behavior. So sleep, I think all of the parents who have children with on the spectrum, including myself, have experienced that sleep is extremely difficult. Sometimes for those kids, insomnia, parasomnia. Sometimes the kids have sleep apnea. So many studies have shown that, and at least 32% have these problems. So there is less melatonin in autism that causes insomnia. Cortisol is increased that can be related to stress response to this dysregulation, and that cause problem with the sleep. Serotonin can be increased and can cause problem with the sleep. And so we have to monitor their sleep. They have a longer sleep latency and more night time activity when we do the testing. So how we manage that, I think sleep hygiene is very important. Sleep hygiene include sleeping at the same time, waking at the same time, no screen time right before sleeping if you can. It's difficult, I know, but if you can, it's better for them. And then melatonin extended release can help to get to sleep, but sometimes it doesn't help to maintain the sleep. 5-HTP can be maybe better for that part. You can talk with your pediatrician, your physician to help you with those supplements. Exercise is very important for sleep. I always recommend that. And combined behavior therapy and pharmacological therapy are the most effective one. And when I talk about pharmacology, I want to say supplement, hygiene of sleep also, okay? So challenge for the parents, the parents don't sleep, the sleeping don't sleep, and the kids don't sleep. And that's a very significant impact in the dynamic of the family. And really, the whole family is impacted by the sleep issue. We talk a lot about it in our paper I shared with you that was published and I put the reference for you. It was 2024, and I think that paper discussed that lengthily. So, key takeaway that ENT comorbidities are very significant. At least 10 times more hearing problem with the children on the spectrum. That can be either conductive because of fluid in the ear, because they have otitis infection, or they have sensory hearing loss. Both together make the hearing loss more significant in this population. Putting a tube is very easy. That can help the kids significantly. Hearing aid can help them. Even with the ABA, we can help them to have better the hearing aid in place if they don't want to have a hearing aid in their ear. Sinus problem can be very significant, 40% as opposed to 70% in other population. Sleep problems, significant. And early intervention is extremely important to help. And multidisciplinary approach that all of these different specialists work together to help the care is very important. So final thought is that ENT manifestation are not necessarily secondary, because sensory disorder for me is really part of the core symptom of autism that is not enough studied, and probably not enough funding to do research on that. And I think it's very important to do that. We try to do those type of research. We have a lab that we try to understand better those problems. But I'm sure that this sensory disorder is going to be one of the core feature of autism, the same way that speech, repetitive behavior, and social interaction are. Hearing, balance, sleep, sinus infection are the pillar of clinical care in individual with autism. Early recognition going to help to understand better. Always rule out ENT problems. Sometimes the kids with autism are brought to me because the parents think that they're deaf, but they are not responding to the parent, or something the opposite. We have children with who are completely deaf. We do the implant, and after 2 years, we find out that children is not progressing as well as the other kids, and we find out that the children have also autism. So you have to always keep in mind the two problems. So remember, improving ENT health means improving communication, learning, family, well-being. So this is my website. You can look at my website. There is a lot of information about hearing loss, a lot of information about also autism. I have an Instagram and a TikTok. We didn't talk about migraine, but migraine has a lot of triggers. And children with autism, many of them have migraine, and that explain their behavior time by time that is significant. And I have a specific TikTok for the young children that they can look at the TikTok and know how to avoid the trigger of migraine. Trigger of migraine is classical, like not sleeping at the same time, having screen time. Sometimes some food are triggers that we have to avoid, unfortunately, chocolate sometimes cheese. For adult, wine can be that. So you can look at those TikTok or my Instagram that we talk about some of those issues. I have also a new book that came out recently about overcoming hearing loss. And in that book, we discuss also the case of individual on the spectrum and other associated issues going on with the hearing loss. We talk also about the cochlear implant, how it's beneficial. And the book is done in a way that patient also can benefit from it, because of the last chapter that has explanation of the difficult medical words. So it's for both physician, patient, audiologist, anybody on the hearing and communication field. My older book that dated 2 years ago was about gut-brain connection, was more oriented to the professionals, talking about the importance of managing the gut, because that can impact the brain function. So I would like to thank you, all of you. I would like to thank and recognize two of my students who helped me with this presentation. One of them is Dr. David Elisha. He's working with me for 1 year and did an outstanding work and helped me for preparing this talk. And the other one is Kaylin McKenna, who just graduated from medical school and was one of the author of the paper we published. Actually, she's the first author of the paper we published about the incidence of otolaryngology manifestation of individual with autism spectrum disorders. So I hope that was not too long, and I'm happy to answer to your question.
All right. Thank you so much for that great presentation. And we do have a lot of questions, so I'll just dig right in for you. The first question is, does a regular ENT know a lot about autism and the topics that we discussed today? Or should somebody really seek somebody trained with autism knowledge or a neuro ENT? Any thoughts on that?
Yeah, I think it's very interesting the question you're asking, because actually myself, I'm ENT, and until I had a kid and autism myself, I didn't know as much about it. But we are trying to actually raise the awareness between the professionals so they know more how to manage the individual with autism. A neurotologist, which is a specialized ENT in the ear problem, are people who knows better about the hearing issues. If your children have problem with the hearing, you should go to see them. But if the children have problem with the sleep apnea, I would like to see an ENT who's experienced with and board certified sleep. Unfortunately, we become more and more specialized, and each area have subspecialists. So a good general ENT knows about overall everything. But if you need a specific, more specialized intervention, there are subspecialized in sinus, subspecialized in ear, we call them neurotologists, and subspecialized for sleep. Now, as every field, you have more up-to-date individuals and less up-to-date. 30 years ago, 20 years ago, no, they were not trained well on that. Now there's more and more awareness. There are physicians who are trained or member of an organization, the name is MAPS, MAPS. They usually are people who are more aware of how managing the individual on the spectrum. You can Google, type MAPS, MAPS doctors, and they are usually more aware of the challenge of the autism, and they can be of a lot of help.
Okay, great. That's really helpful. And related to that question, somebody asked, does it make sense to say to your doctor, I'm autistic? So because I have autism, could you look more into these sinus complaints? Or could you look more deeply than you would for a neurotypical patient? Because my problem might be harder to detect. Would a doctor be receptive to that? Do you think they'd want to?
Yes, I think so. Yeah, I think it's always good to be upfront, sharing with your doctor about your various type of health condition. I think being autistic is something very common. I see a lot of autistic individual. I'm very happy to see them. And when they share that with me, actually, I'm very happy, because then I know that I have to look at other things. I do not also that if you are on the spectrum, you become obsessed about, oh my God, do I have sinus problem? Oh my God, do I have that? No, it doesn't mean you're going to have it. No. If you have problem with the sinus problem, yes, then it's worth to go and talk to your doctor. If you have problem with the sleep disorders, again, adult and children are two different situations. Adult can express themselves. They have more awareness of their body, and that's the good part. Unfortunately, children on the spectrum, they do not have yet that self-awareness of their condition. So as a parent, we have to be a little bit more aware to look for those symptoms. But usually my adult patient on the spectrum, they know their challenges, health challenges, I want to say, and they express themselves well, unless some of them are not able to express themselves because now they have less speech possibility, and then obviously then it's good to write it or use other method to express that to your physicians.
Okay, great. So I've gotten a few questions about, you talked about the gut microbiome, and people are asking questions about probiotics and different supplements. So if somebody has interest in addressing that, what kind of clinician should they work with? Like, who would you suggest they talk to, or can their ENT be part of that team? How do people usually tackle that?
Well, I'm going to be honest with you. Unless your ENT or doctor is a little bit more familiar with the integrative medicine, some of them are hesitating to give you recommendation because they don't know. Sometimes they don't know and they say don't do it, unfortunately. But I think if somebody knows, and you find a good physician who's able to integrate the functional medicine with the classical medicine, I think that's going to be great. So yes, you can try, but don't be surprised that maybe your physician don't know about recommendation about those supplements. Then you should maybe look into someone who's more familiar with the integrative medicine. There are very good doctors who knows about those things, and they can help you.
Okay, so they could look into that, or they could even talk to a nutritionist or a dietitian maybe who could help
Definitely,
them. Yeah.
definitely, definitely.
So they could have, so if they're in a smaller community and they can't reach a specialist, maybe they could consider those routes for that kind of support.
Yes, and there is good website too. There are website that give you some advice. Now fortunately with the AI, it's easy to get information easier.
Okay, great. For sleep, this person said, sleep, oh, sleep. Do we need to routinely consult with airway trained ENTs? Any routine tests that can help test neurotransmitter levels, anything like that, that they might communicate with a clinician?
The test for a neurotransmitter is not done typically. Is more research at this time, unless there is a significant issue going on that neurologists or your psychiatrists want to test something specific. People don't do those tests. Uh, but for your sleep, uh, if you are tired during the day and sleepy, if you are driving and when you are waiting at the red light, you are feeling that your eyes are closing and you cannot stay awake, that means maybe you have sleep problem. You're not sleeping enough. That's something that you have to go and share and talk with your physician. Say, hey, I'm not sleeping well. Or if you are overweight and you have a short neck, your neck is not very long enough, you're overweight, then obviously there's less space for the air to get to your lung from your oral cavity and the uh, larynx and trachea. Then you are more at risk. Okay. So if you have very large tonsils for kids, young kids, when they have very large tonsils, sometimes they cannot breathe well at night. So they sleep with the mouth open. If the parents see the kids with the mouth open, sleeping at night, snoring a lot with the mouth open, then you should actually see your pediatrician, your physician, to see if you don't have a sleep apnea.
Excellent, thank you. Do you know of any research that looks at a correlation between autoimmune conditions and inner ear issues?
Yeah,
So
there are.
thyroid or anything like that?
Sorry, what was the last thing?
Maybe thyroid or other auto, like rheumatoid arthritis, that sort of thing.
Yes, yes. Actually, there is an entity we call that the inner ear autoimmune disorders that we see in patients who have other autoimmune problems. Those individuals typically have hearing loss that is more sensorineural hearing loss as opposed to conductive, and I explained that to you guys at the beginning. So those patients usually have a bilateral actually hearing loss, and that goes the threshold of hearing goes lower and lower and lower, and that become more challenging for them. So those patients have thyroid problems, usually have diabetes sometimes, and other problems. Yes. So there is a treatment for that. Yes. We actually
Okay.
have a chapter in the book specifically about those issues.
Okay. So this next question is about, I've gotten quite a few questions specifically. I don't want to put you on the spot about diagnosing people's different problems, but some of the questions have been consistently asking about getting a good hearing test on an autistic person and feeling like they know that they got a good hearing test. And I know you're an ENT, so hearing's a little outside of that, but How do you advise patients to go get a really good hearing test so that they're sure for an autistic patient that they did the very best that they could?
I am ENT, but all of the hearing is my area. So don't worry. This is a good question for me.
Okay, good. Yep.
So I have audiologists who work in my office that do the test, everything. So a hearing test, when it's done, the person awake, respond, what happened is you go to a room, you put a headphone, they put different sound, different frequency, and then you have to respond if you hear them. So there is an element of subjectivity and cooperation of the patient with the test. So if the person is a high functioning, the term high function is not maybe good, but someone who's really able to express themselves, don't have too much sensory problem, then the test can be very reliable. Okay. But if the test is not reliable because the person has a lot of sensory disorders, challenges to do the test, then we can do the test with an ABR, which is an objective test that does not require the participation of the patient. So patient, if he's an adult, we can do it in the clinic, relaxed. We put some electrode in the brain, on the skull, not in the brain, on the skull, and some sound in the ear, and we look at the wave, and we can measure the level of hearing. For the young kids, we don't do that in the clinic. We do it usually in the operating room when they're asleep. We call that ABR testing.
And so they can get a good sense. So parents can, if that's what they think is needed, or individuals, autistic people, they can advocate for that kind of testing rather than just the standard sitting in a booth, if that's what they feel they'll
If the
need.
test in the booth is not reliable, yes, they can ask for that. Yes.
Okay.
Yes.
Okay. So this question came up a couple times. I even got an email about it. So earwax plugs. This parent is saying that this seems to be more common in their autistic child, and it's difficult to remove it. So is this something that you see? Is there more common earwax issues in kids on the spectrum, or is this just a coincidence?
Yeah, I don't want to say it's more common, but I've seen it a lot. One of the reasons is that probably it's difficult to clean it.
Yep.
And when it's difficult to clean that, then it's going to stay there and you're going to see it again and again.
Yep.
Okay. So I actually have a TikTok and Zoom, Instagram about wax in the ear and Q-tip.
Oh, okay.
I recommend you guys to look at it.
Okay.
It's about Q-tip and about earwax. So look at that. It's going to explain you why we should not use a Q-tip. Because when you use a Q-tip, you got to push more the wax in the ear canal that make it more difficult to get it out.
Yeah, it might feel good and you might get something on there, but it won't necessarily cure the problem.
No, you got to make it worse. And the Instagram got to show you that got to make it worse because you got to push it more inside. So it's more difficult to clean the wax in the individual on the spectrum. If we know that the person have hearing problem, I'm going to go to the surgery for ABR testing, then we clean it there. We don't need to do it in the clinic. Otherwise, sometimes we can use baby oil, few drops, a few days in a row, and that's going to make it smooth and that's going to come out. I don't like too much to use Debrox because that dry it up and doesn't come out, make it more difficult to come out. But if you know that you don't have any perforation of the eardrum in your ear, and most of the people don't have that unless you have ear infection, discharge, and all those things, putting the baby oil in the ear can make it smooth and come it out. Do not use candle. Some people use candle in the ear. We do not recommend that, okay?
All right, great. That's really helpful. So I got a few questions about tinnitus. And is there an increased likelihood of tinnitus in people with autism, or do we know?
Yeah, we actually published a paper. I published a paper a few years ago. Now we don't use anymore the term Asperger, but at the time there was one of the classification of the DMS-4 about Asperger. And the paper is about, it doesn't talk about autism, talk about Asperger. That's why if you Google my name, you don't find the name autism, but you find Asperger. You find out that the individual with Asperger disease have a higher incidence numbers of tinnitus or tinnitus, we can call it as we want.
Mm-hmm.
So it's more common. So why is it the case? We don't know exactly. There's few theory, few hypotheses. Usually, if you notice, some of the individuals with autism hear much better than other people. So they are more sensory oriented. They hear better.
Okay.
There is more tinnitus in that population. So remember, again, if you have tinnitus, I have also a TikTok and an Instagram about tinnitus, and you can listen to see things that you should avoid. But 4 things I always say to my patients when you have tinnitus: avoid noise exposure. Noise exposure going to make the tinnitus worse. The second thing is avoid too much coffee. Caffeinated drink going to make you to more be aware of your tinnitus. 3, avoid focusing on the noise. More you think about the noise, more you're going to hear it. And 4, try to use relaxation technique, and all those things going to help for tinnitus.
No cure, but there are ways to cope with it, it sounds like.
So I don't like when you talk about no cure, because we can help a lot of people with tinnitus. There is a lot of help and a lot of things can be done. One chapter of my book is about tinnitus management, and we talk about that in length, that what is the problem with the tinnitus. The noise and sound is all the time around us. It becomes difficult to us when it becomes part of our emotional interaction with it. So we focus on it. Otherwise, there's sound all the time. So the key is to learn how to separate the emotional connection to the sound that we have when the sound is there. When you buy a new refrigerator in your house and you sleep in the same room, imagine you hear all the time the sound. The first day, second day is very horrible, okay? But after 1 week, 2 weeks, you become used to it and it doesn't bother you anymore. You're habituated. So the key is to know how to habituate yourself to the sound, how to make this sound less bothersome to you. Then that means that there's a cure because you treat you, because the sound is always around us in the life. It becomes a problem when we cannot stop focusing on that.
Yeah.
And there is technique to do that. So never listen to someone who say there's no cure for tinnitus, because there is a lot of options, a lot of things to do for helping patients with tinnitus. Okay?
Okay. Yeah. So for an individual, an autistic person, it might involve some cognitive therapy that helps support trying to use these coping strategies so that they can use it effectively. Yeah.
So that's one option is the cognitive therapy, as we say. Another option is sound therapy. Sound therapy is to introducing some sound with the same type of frequencies that your tinnitus is there, so you become used to that sound, so you don't hear it anymore. For some individual who have hearing loss and tinnitus, if you give them a hearing aid just to hear better, because you bring some sound, external sound, they're going to be much improved for the tinnitus. So you see, there's a lot of options, a lot of options.
Oh, well, that's really helpful because we did get quite a few questions about it. So appreciate that. Okay. And to people who did ask specific questions about treatment or analysis of their loved ones, important to actually reach out to an ENT, a clinician, so that they can get specialized, specific care for them. So I'm not going to put those questions out there today, but I want to acknowledge that those were asked. I'm going to ask you one more question. I think we have time for one more. This person is asking, have you seen cases where treating sinus or nasal problems actually led to improvement in mood and focus? So have you seen a connection between mood and focus and sinusitis and these other things?
Yes. When you have inflammation in your body, okay, and actually individuals with autism have a lot of inflammation in their bodies. If you have too much inflammation, that can impact your focus, that can impact your attention and your well-being. Any type of infection, sinus infection, ear infection, can increase the inflammation in your body. Therefore, that can impact what you are telling me. So in the children, it's very common. You can see kids who have autism, sinus infection, ear infection, they regress. Temporary, So I'm familiar with that. I told you I have family member on the spectrum, and I deal with that all the time. So why? Because we increase the inflammation in the body, and that inflammation that is increased can cause those problems. So I think it's always good that when you have those type of sinus infection or ear infection, always try to manage the inflammation in your body too. There is a good way to do that. There's some natural way to manage the inflammation. Curcumin, turmeric, the root of turmeric, the plant is very good anti-inflammatory that can be used for individual on the spectrum to decrease the body's inflammation.